It's International Women's Day 2023, and I feel so excited because it's our first official celebration as Preggify. And the theme of this year speaks to us personally because we are an organization that looking for innovative ways to make access to pregnancy and after-birth care more convenient and timely for career women who are focusing on building their business or pursuing their career goals. It's a thing of joy to see that the world is now beckoning on everyone to key into the digital age that we are in, especially we that are in Africa. It is difficult for a woman to carry on her career alongside pregnancy and early childcare. So you see women who are either left with choices of going to raise a family and then take a long break for like 5 years and then return to the workforce, and it is not always a smooth transition because many of them don't come back to the workforce, and we don't know the talent that we're losing out there that will change the world just because they went to raise their own family. Or women who have said to themselves, see, I'm not cut out for this family life, I just want to pursue my career. So if we do not create an enabling environment for these women to understand that they can actually thrive in their career and also be able to raise their own family, we are creating a gender inequality and making it difficult for women to fully maximize their potential to be who they want. For instance, here in Africa, the maternal health care system that we practice is still the routine. So the care we give to women who are pregnant is not individualized. So we don't differentiate Mrs. A from B, and we don't even ask them for their preferences. We just put everyone together and say, okay, this is your antenatal day, come to the hospital. And what happens? In 2021, when I was still active in the clinical practice, I once had a client who was a career mom, but we didn't know the best way to serve her. So we put her together with every other woman out there to come for antenatal, and she was not coming. We didn't understand it. We called her and we're blaming her. Madam, you are pregnant, you're supposed to come for antenatal, you are not accessing teaching, you don't come for your routine check, you don't come for your blood test, you don't do anything. We don't understand what she was passing through. This woman might be the breadwinner of her family. She might have responsibilities. She have a business to pursue. She has a career goal that she's aiming to achieve. And at the end of the day, she developed complications of hypertension and separation of placenta, and she lost the pregnancy. That was when I started thinking to myself, how can we help these women? Because there are a lot of women out there who are financially independent and educated, but they don't know how to use what they have to assess the kind of health care that they deserve as career women who are raising their own family. This is where we need to integrate technology to help these women assess care at their convenience. If a woman is supposed to go to the hospital 100% of the time during pregnancy, can we say to ourselves, all the 100% that this woman is coming to the hospital may not be necessary? Why not create a system that will help these women to prioritize what is taking them to the hospital? Why not create a system that helps them to triage, to help them analyze the symptom they have? Is it cough? Is it vomiting? Is this stooling? Is this leg swelling? What's causing it? A system that will help them to analyze it and say, okay, this is something we can take care of at your convenience, or this one is what is going to take you to the hospital. Because at the end of the day, what we see is that some of these women who are very interested in career and they are pregnant, they neglect the pregnancy part of their life, and sometimes they develop symptoms that they don't know that it is even serious. So they go about their career and they go into complications that may eventually take their lives. So if we are fighting maternal mortality in Africa, we need to find a way to create an enabling environment to help these women pursue their career goals and still be able to be the wife and the mother they want to be. Thank you so much for listening. Happy International Women's Day. I am Dr. Ifnaya Igweze, founder, Preggify.